Mebeverine hydrochloride is a type of medicine known as an antispasmodic. It helps with muscle spasms. It can be used to ease painful stomach cramps if you have irritable bowel syndrome or other conditions. Mebeverine comes as tablets or slow-release capsules, also called modified release. It is sometimes available as a liquid if you have trouble swallowing tablets. Indications: Mebeverine can be taken by most adults and children aged 10 years and over. Mebeverine is taken to relieve bloating and crampy pain in the lower tummy, abdomen. How to use: doses vary depending on whether you are taking tablets, capsules, or liquid. Try to space doses evenly throughout the day. Standard release tablets 125 mg. The usual dose is 1 tablet taken 3 times a day. Slow release capsules 200 mg. The usual dose is 1 capsule taken twice a day. It is best to take your Mebeverine 20 minutes before a meal. If you take it twice a day, take it before breakfast and dinner. If you take it 3 times a day, take it before breakfast, lunch, and dinner. Swallow the tablet or capsule whole with a drink of water. You will usually only take Mebeverine if you are having a flare-up of your IBS symptoms. Stop taking Mebeverine when you feel better. This may take up to 2 weeks. Talk to a doctor if your symptoms are not better after taking Mebeverine for 2 weeks, or if they get worse at any time. If you miss a dose of Mebeverine, skip the missed dose and take the next one as usual. Do not take a double dose to make up for a missed dose. Contraindications: Mebeverine is not suitable for some people. Tell a doctor or pharmacist before taking Mebeverine if you have ever had an allergic reaction to Mebeverine or any other medicines in the past. Have constipation caused by a condition called paralytic ileus, an inactive gut. Have a rare inherited condition that means you cannot digest galactose, a sugar found in lactose. Are trying for a baby, pregnant, or breastfeeding. Before using Mebeverine without a prescription, check with a pharmacist or doctor first. If you are 40 years or over, have blood in your poo, are feeling or being sick, nausea, or vomiting, have lost your appetite or have recently lost weight, are looking pale and feeling tired, have unusual vaginal bleeding or vaginal discharge, have or think you may have food poisoning, especially if you have recently traveled abroad. Precautions: it is generally recommended that you take Mebeverine only when necessary. So start taking it when your symptoms flare up and continue to take it until you feel better. Stop taking it when your symptoms settle down again. It is usually within a week or 2. If you develop any new symptoms or your symptoms get worse, make an appointment to see a doctor for future advice. If you have bought Mebeverine for irritable bowel syndrome and your symptoms have not improved within 2 weeks of taking it, you should see a doctor for advice, even if you have previously been diagnosed by a doctor. Side effects: like all medicines, Mebeverine can cause side effects, although not everyone gets them. Any side effects are likely to be mild and will usually pass quickly. It happens rarely, but some people might get a mild itchy skin rash or swelling. If this happens to you, it may help to an antihistamine which you can buy from a pharmacy. Check with a pharmacist to see what type is suitable for you. Stop taking Mebeverine if the side effects bothers you or does not go away. Ask a pharmacist or doctor whether they can recommend a different medicine. In rare cases, Mebeverine can cause a serious allergic reaction, anaphylaxis.